is Angela Bethea, and today I will be discussing art therapy. I am doing this to inform my audience about the benefits, forms, and advantages of art therapy. By highlighting the benefits and methods of art therapy, my audience will have an increased awareness and ability to benefit from this form of therapy. 4 in 10 adults ages 15 and older have endured significant depression or anxiety, or know a close friend or relative who has endured significant depression or anxiety. With anxiety and depression rates on the rise, it is important to find ways to manage it in order to live a happy and fulfilling life. One such way to manage anxiety and depression is through art therapy. I have personal experience of using creative methods to help me work through when I am struggling with bouts of depression. Expressing myself through artwork has helped me make sense of my experiences, feelings, and dealing with loneliness. I will begin by discussing why art therapy is beneficial. Next, I will discuss the different forms of art therapy. Finally, I will explain the benefits of art therapy over antipsychotic drugs. Let's begin by looking at how art therapy can benefit those struggling in the modern world. Art therapy comes in many forms and has many benefits. Art therapy helps people feel in control of their lives while reducing rates of anxiety, depression, PTSD, and other mental illnesses. Art therapy helps manage pain and moves the mind away from painful stimuli. As Matthew Karnowski, who runs an outpatient art therapy clinic, states, art therapy encourages self-exploration and expression. It encourages more vulnerability simply through art being an expression of oneself. By externalizing their emotions, thoughts, and behaviors through art, they feel less judged or ashamed of themselves. Art making may give clients an increased sense of control over what they disclose. Art therapy can also be used to null physical pain. An example of this is listening to music, because it helps distract the mind from focusing on painful stimuli. Now we will look at different ways to implement art therapy and some examples of those implementations. Different forms of art therapy can benefit people depending on their circumstances. The first form of art therapy that I will discuss is creating artwork. The movement of painting can be therapeutic for patients and help reduce stress by the repetitive motions associated with the art form. It can also help patients make sense of traumatic situations. An example of this is a famous Mexican painter named Frida Kahlo. Frida Kahlo was a famous painter who had a traumatic accident. After the accident, she began painting as a way to cope with her pain. She continued this through her additional sources of pain, such as miscarriages and her tumultuous relationship with her partner. Music therapy is beneficial for a variety of patients. Playing an instrument can help support patients experiencing mental and cognitive disconnections. Singing can also help patients with their breathing and speech patterns. The final form of art therapy I will discuss is movement therapy. Movement therapy can take different forms as well. An example of movement therapy is dancing by mirroring another person. This can increase social engagement and also helps manage chronic pain. Art therapy is preferential over other forms of therapy for a variety of reasons. So finally, we will look at why this is true. Art therapy has the same benefits as many antipsychotic drugs. Most antipsychotic drugs for depression work by increasing serotonin levels. Serotonin is a hormone in your body which helps increase the good feelings such as happiness. According to Palm's Behavioral Health, art therapy also works by increasing levels of serotonin within the body. This is the same way as previously stated that antipsychotics work. However, antipsychotic drugs often have chemicals that interact with other medicines or other brain chemicals and can cause negative impacts. In conclusion, art therapy can effectively help both reducing mental and physical pain and can take different forms depending on the needs of the patient. It does all this without triggering unexpected side effects from drugs. While not everyone is artistically gifted, finding a way to express oneself can help anyone navigate their pathway through life, even in the midst of increasing anxiety and depression.